is Dr. Sesi Mabona. I am 28 years old. I'm a qualified medical practitioner. I studied at Sefako Health Sciences University for a duration of 2015 and qualified 2020. And then after that, I went straight into internship. I got my internship placed at Leratong Hospital, which is in the West Rand. And then after that, after 2 years of internship, I went to do community service. I just finished my community service in December. I did that in Benin Summer Hospital, which is a district hospital down in Mpumalanga. Like they say, a community. I was serving a community then. Currently here at this practice, I am locuming, which means I assist whenever required. So here we see quite a lot of versatile patients as in an outpatient kind of a situation. Here we see it's a family. We see an entire family from your pediatrics, the family dynamics to the elderly. We cover different areas. For example, we offer procedures like post-surgical procedures. We can look after the patient after that, or fertility facilities. We have pediatric facilities, and we also have aesthetic facilities, which is a very new and interesting area to venture in currently in healthcare, because everybody wants to look beautiful, if I may say. Yeah. And I'm currently enjoying my time here in the practice, and I'm learning quite a lot of things. I'm doing quite a lot of healthcare work, in which here we most focus on prevention and assisting our patients to get a better quality of life before they actually get worse or get sick. We see them first, and then we make sure they don't deteriorate. We keep our patients healthy, and we keep our family happy. So everyone who walks in through our doors is automatically part of the family, because we are already a family ourselves. I collaborate with other specialties in a sense that a physician, which is an internal medical specialist, which I'm currently venturing into. Though as a physician, we do not just see, we see patients who are non-pediatric. So we see almost everything. So here, like I said, it's a family. So as a primary healthcare provider, a physician currently fits into the puzzle very, very nicely, as we can assist the general practitioner in taking care of the patient from the clinical aspect to the mental aspect of it. And I feel like an internal medical practitioner in this facility is very much required and very much a necessity, as the practice itself is multidisciplinary, and this discipline covers most areas of our family. Given the socio-economic status of the patients we see, the most common conditions, of course, with the growing economy of the country and the people, we mostly see as shifting from the poverty-related conditions to a much wealthier conditions like your hypertension, your diabetics, your heart conditions, and obesity as a main contributor to such conditions. And in terms of diagnosing these patients, we screen them daily and regularly when they come in, and we give healthcare education in terms of your diet, the necessity of exercising, and for regular checkups. And once a patient has been diagnosed with either any of the conditions or at risk of having such a condition, we can pick them up early and then help them not get worse or get ill. So in a sense, we are actually what medical healthcare should be doing in the first place. We shouldn't be treating patients because they're ill. We should be treating patients because they don't want to be ill. The most effective way to educate someone is to actually sit them down and calm down yourself. Don't be a doctor at that point in time, because you're now educating someone in terms of their health. They are more scared being in the room than you can actually think. So they don't want you to flex your 6-year degree and your experience. They want you to actually explain to them in a manner that they can understand that what is actually wrong with them, what they can do to get better, and how are you going to assist them get better. And if I'm going to do a blood test, if I'm going to do a procedure, I have to sit down with the patient, explain to them, why am I doing the procedure? Why is it a necessity? And after I'm done, they have to know what happened. Are there any results? Is there anything abnormal? So sitting with a patient down is actually a priority, one of the basics of being a doctor. Like, we do not talk standing. We do not rush into a consultation. We take our time and we understand and we learn these persons in terms of their education, their level of education, and you come down to their level and you actually explain to them everything. So that is how you teach someone, by sitting down and explaining to them, so that they themselves can be able to educate their families, because they've essentially understood what you said. If I say, I need you to exercise because I want you to lose weight, and I explain to them why I want them to lose weight, I don't want them to get hypertension, I don't want them to get diabetic, and they will then take that information home and then implement it amongst their families. So you'll find that the whole family now is a healthier family than you expected. Preventative care can be when I meet a patient before they even get a symptom, before they even get a disease, or before I suspect a disease. During a casual conversation, during a consultation, I just casually put in some of the ideas, like you should not have a lot of salt in your diet. Exercising should be a regularity, and you should come in more often for us to check your blood pressure and check your glucose, and the importance of such parameters and involving such measures into one's life and how they carry on their daily living is quite important. So that is how we will go about preventative measures, and we print out pamphlets and we educate our patients. So that is how we incorporate preventative measure and make sure that our patients do not actually get to a point that we're running around, we're looking for medication that is out of this world, and we are now coming up with new things when we could have prevented them from getting sick in the first place, preventing health burden, therefore ensuring that these people are actually economic. They contribute to the economy much better, and they contribute to our family in our practice much better, because not only will they be here always being sick and always being transferred to the next facility or to a higher facility, but we are able to keep them healthier and within our facility. As a young person, of course, I am always on my phone and always seeing technology evolve. It's such a privilege to be part of it, actually, and to see it work and function for the better in medicine. It's also quite something fascinating. And I'm hearing stories. I've never seen technology not at work. Ever since I started practicing, technology has been working wonders for me. So you'll hear people telling you stories about how they had to wait for things, how they had to wait for tests, how they had to wait. Waiting is not a thing in medicine anymore. So we don't waste time diagnosing a patient taking forever. Technology is working at our advantage, if I may say. It takes our knowledge and puts it into practice and puts it into action. I can get a blood test of a patient and it can evaluate for me what is actually wrong with the patient. I don't have to crack and open a big chemistry book that I studied in med school. I don't have to carry those around anymore. I carry just a simple phone and a laptop, and I can get my patient records from wherever, whenever they require me to look into their records. I can share them, which is a nice thing. I can share them with whichever facility I'm referring the patient to whenever I'm required. So communicating between us medical practitioners and actually knowing what has been happening with the patient all their lives has become very easy. I don't have to give them a big file that is brown with a lot of pages that go missing anymore. I just send them a document and they have the whole patient's life in front of their eyes. They know how the patient has been vaccinated from birth, how they've grown up, they became a teenager, and now they're an adult, and therefore they can incorporate all that information to assist this patient better and facilitate their healthcare. I don't have to sit with the patient down and ask them anymore, oh, which tablets have you been taking? How long have you been taking them? What is the dosages? Because now I'm lazy enough to go through this file. I can just look it up on my computer. I'm like, oh, you've been on this tablet for this long, and I can now evaluate, is it effective or not? Should I change it or not? And therefore making healthcare and facilitating patients convenience very much better. Starting off the career, I won't lie, it was quite tough, because now I'm fresh out of med school. You are doing 24-hour plus calls a day. You are on your feet the whole time. It's quite frustrating, and your other life comes to a standstill. What I've learned and what got me through, and that's still getting me through, is that you have to love the art of medicine. Because if you do not love the art of medicine, honestly, you're going to quit. It's going to be a dreadful period. You're going to hate your life. You're going to hate your patients. You're going to dread seeing a patient walk through your door. But if you actually love what you're doing, the hours and the hectic durations of procedures, they won't matter as long as you know what goal you're going to, as long as you know you're here to help a patient and you're here to learn and better yourself. Of course, it's going to be a wonderful period of time.